underserved population. I want to make sure that whatever.
He has always been my nemesis.
Strong word.
Biomedical Sciences from North Carolina State, Quack, where he also earned his bachelor's degree in biology and plant biology. He currently serves as a research program leader at the Duke Cancer Institute, where his work sits at the intersection of clinical research operations and health equity. He leads initiatives focused on increasing diversity in cancer clinical trials and expanding community access to cutting-edge research. His scientific contributions are significant. He developed a live imaging system that tracks how tumor cells move through the body, and his team coined the term angiopolosis? Okay, to describe how therapeutic stem cells exit the bloodstream. That work forms the foundation of what he calls the cancer exodus hypothesis. The recognition has followed. He was named to the Forbes 30 Under 30 in Science, MIT Technology Review's 35 Innovators Under 35, and the Root 100. His research is personal for many of us in this room. He is working to make sure that people who look like us are represented in the science that is supposed to save our lives. Please welcome Dr. Tyler Allen to the Olandus Foundation Lunch and Learn.
So much my background was good in sharing.
We just love that tabby.
I appreciate that. Thank you. So, like I said, I'm Tyler, and I appreciate that different position where I'm using that background as a researcher, but at the clinical trials department or clinical trials division at the Cancer Institute, to figure out ways and lead initiatives to increase diversity, enrollment, equity for our clinical trials and our clinical research, so that everyone and the people like us in this room are getting the same access to the clinical trials. We're making sure that the research and the clinical trials that we're doing are representative of the population, the people who actually get cancer and have cancer, so that the treatments, the drugs, the therapies, and all the different components of cancer and cancer treatment reflect the population and are applicable to those who get cancer, regardless of their background, their socioeconomic status, their lived experience, or whatever.
Promise to you. So look out for that, for sure.
And Sean, hold on one second, since Dr. Coring is actually answering questions. I'm gonna go ahead and read his bio for people who aren't familiar with him. He's gonna be our next guest speaker. His journey
To mitigate cancer-related illnesses. Am I read it again?
Oh yeah, I'm sorry.
Okay, from a prevention standpoint, what should we do to mitigate cancer-related illnesses?
These lung cancer can be completely different from each other at the genetic level, the biologic level, how they respond to treatment, how that person responds to cancer therapy. So, and this is another question that I get was, why do we have a cure or a treatment that is for all cancers? Because there's so
Recommend is what we call a neutropenic diet, meaning that your immune system is low because the cells that compromise or compose your immune system is pretty much not there or very few. So therefore, you need to be on a diet that's going to highly impact the build. It's a sacrifice. And the sacrifice,
regardless of how I got it, I got it. I always like to say I have myeloma, but myeloma don't have me.
That's right.
So that's why I'm in a good place in my life.
a new cancer diagnosis occurs roughly every 15 to 30 seconds. So somebody out here just got diagnosed with cancer. Wait 30 seconds, somebody else just got diagnosed with cancer here in this country. So that translates to over 1.2 million Americans developing cancer.
Broke the yoke from my head, set my feet in promised land.
Yeah, when I first went, I got and perhaps stand for renal. Myeloma likely to affect the kidneys. The proteins that these plasma cells are producing, it basically clogs the kidneys up, causes obstruction. And so we look for the creatinine to assess to see if that arteries or the kidneys are affected. The A stands for anemia, the hemoglobin. You know, that's a blood cell line that's affected by most cancers, blood cancers, including myeloma.
Because our knowledge of how these diseases affect us can help them with all of the medications and all of the needs and the wants of the patients when it comes to providing transportation for somebody. You know, knowing that someone lives in a rural area don't have access to some of these treatment options.